the Johnson & Johnson COVID-19 vaccine. As of April 12th, the more than 6.8 million doses of the J&J Janssen vaccine have been administered in the U.S. CDC and FDA are reviewing data involving 6 reported U.S. cases of a rare and severe type of blood clot in individuals after receiving the J&J vaccine. Now, in these cases, a type of blood clot called cerebral venous sinus thrombosis was seen in combination with low levels of blood platelets. All 6 cases occurred among women between the ages of 18 and 48, and symptoms occurred 6 to 13 days after vaccination. Treatment of this specific type of blood clot is different from the treatment that might typically be administered. I don't want to get into all that because that's more your territory. Good morning, Dr. Felix Cabrera, the Chief Medical Officer for Public Health. This was pretty big news, and really just I think the final chapter maybe in the saga that has been this Johnson & Johnson vaccine, which has been troubled from the start, Doc. But what does this mean locally?
Good morning, Chris. Good morning, everyone. So what it does mean locally is that, so the FDA and the CDC have recommended this pause in the administration of the Johnson & Johnson Janssen vaccine. And so we are of course, heeding this recommendation, and we will locally also pause the administration of this vaccine. But and give it time, and as an abundance of caution, as they give it time to collect more data and more facts about these cases, and maybe seek other reports that may have not yet been reported, and then give time to assess that, and then make recommendations before resuming. And we expect that this pause is only going to last several days, and so it's not going to be we do not expect this to be a permanent pause in any way. And that it's something that's extremely rare. And so far, as you just read, that it's 6 cases out of actually almost 7 million vaccines already administered. So that's less than 1 in a million when you think about that. And this type of serious blood clot, cerebral sinus vein thrombosis, is actually, it naturally occurs, as we know it, as less than 1.5 in 100,000 persons in the general population annually. And so already, seeing it in relationship to those who have gotten the vaccine, it's already, it appears to be a much less chance than what we know about the disease already. So we have to keep that in perspective. But the data is very low right now. We got to give it a chance to really look at this, in particular because of the correlation with what's happened with the AstraZeneca vaccine in Europe, in where they were doing the same thing when there was a pause and they looked at the cases. And then ultimately they resumed it, and they made the recommendation to resume because they didn't feel that it was necessarily a significant increase in the risk of this blood clot disorder occurring just because you got the vaccine. That if it did happen to you, it was probably going to happen at some point just by pure bad luck. And so it's the key thing. I'll just say with this is that when it comes to the most important scientific concept in this case is that correlation does not automatically mean causation. And so we're seeing a correlation, but it's not necessarily a causation, as in the vaccine doesn't necessarily mean that it's caused the clot, but we're seeing the correlation. You need more data, you need better information to definitively say that, oh yeah, it's caused, there's a high likelihood that it's caused by it.
Right.
If that doesn't make complete sense, I'll just use a very simple real world fact. It's like, let's say you flip a coin, and you flip it only with your left hand. And when you flip the coin, you notice that it lands on heads more likely when you flip it with your left hand. Now that's just you looking at what you're seeing there at the time. And so did your left hand actually cause the coin to land more on heads than tails? That's a correlation you're seeing, but is it really a causation? Now, flip that coin 100 times on your left hand, and then flip it 100 times on your right hand. I guarantee that you're going to get closer to a 50-50, a chance that you're going to see it's going to land on heads, right? Do it 100 times, 100,000 times on either hand, and it's going to get even closer to 50-50, because because that's the true odds. Your left hand doesn't cause the coin to land on heads. So again, it's just that concept of causation and correlation. And we don't know that yet. But we want to be sure. And so that's why the FDA and CDC have made this recommendation so that we do it as safely as possible, because safety is still number one.
The release further reads, the CDC will convene a meeting of the Advisory Committee on Immunization Practices on Wednesday to further review these cases and assess their potential significance. Until that process is complete, we're recommending a pause in the use of the vaccine out of an abundance of caution. This is important in part to ensure that the healthcare provider community is aware of the potential for these adverse events and can plan for proper recognition and management due to the unique treatment required with this type of blood clot. Doc, are we able to treat this type of blood clot on Guam?
Yes.
Yes,
and so that's one of the key things about this pause, is because so when people think about a blood clot, the most common blood clot that we see in people who experience them are something called a deep vein thrombosis, and typically would happen, like, let's say, in one of the deep veins in your leg, and then you get leg swelling and so forth. And if that clot dislodges and goes to your lungs, that could lead to serious complications as well. Now, that type of clot is treated in a very specific way with specific blood thinners. Now, the clot that we're talking about here, that we're seeing in these cases, is the cerebral sinus venous thrombosis. You cannot use the most common blood thinner, which is called heparin, and that could actually make it so much worse. And a lot of physicians, for example, don't know that, or because they just don't. It's just not part of their typical practice, and they may reflexively go to heparin to treat it. And that's something you cannot do. So that's part of this. It's a pause so that to get the medical community to catch up and review what the treatment process is. And if they by chance were to come across a case of somebody with such a clot disorder. And so that's part of it. It's a chance to pause and review and re-educate.
Doc, how is this going to affect our journey on the path to half?
It is going to make it tougher. I will admit that. Without the Johnson & Janssen vaccine, we're going to, we'll get to 50%. The question is, will we get to it by May 1st? That's a little bit up in the air now. Depending on how long this pause is and what the community's response is to this pause overall. So we have to consider that. Now, is it the end? Now we have to remember safety number one. And is it the end of the world that we don't get 50% by May 1st? No, because that was a date that we set a target for. It was a somewhat arbitrary date, but it was a date that we thought we could achieve. And if it pushes it a little bit further, then it pushes it a little bit further. And as long as we do it in the safest way is the most important part here.
How much vaccine do we have on hand for the J&J? And then are there any issues with storing it and it still being effective after this pause?
Yeah. So the good news is that we've been promised a fair amount. Well, that was easily going to push us over about 18,000 or so for just this month. But the good thing is that we haven't ordered, all of them all at the same time, and that we've been only ordering at small increments because of the storage time is less, and so we wanted to ensure that we didn't have any spoil on Guam, of course, and so we're okay right now, and so we need to, and again, I don't think the pause is going to affect that.
But just playing devil's advocate here, as I often do. There was already with the abortion thing, right? The aborted fetuses, and the church had come out, so there was some trepidation on people not wanting to take the Johnson & Johnson, and then now this. I guess just were people, because I know it's kind of like the option C of our vaccination effort, right? Because everyone's like Pfizer, Moderna, and then Johnson & Johnson, which was being used for, I believe, the homeless and the prison, but. That being said, do you anticipate that people will still want to take Johnson & Johnson after all this?
I think so, and here's why. Because even after all the conversation about it's actually the demand for it and the popularity for it was actually, yeah, it's actually quite high and higher than we anticipated. And in particular, because of two things. One, of course, the convenience, right? It's one shot and you're done. The second part was that it's still extremely effective at preventing the two main things that we want to prevent, which is severe disease related to COVID and deaths related to COVID. And it's still very effective in that. And it's effective in protecting you and protecting your loved ones and your community. So those were the key motivating factors. And so, still getting a lot of calls about, before all, of course, all this news about, what are the options to get it, because some people just really want it and want to be able to get it and be done and be able to do what they want to do. Some people want to do it before they travel, whether or not that changes anything for their, for the requirements for travel, but they just want to do it for peace of mind. And so that's an example there.
Were the people who were getting the Johnson & Johnson, the adult daycare registrants, senior citizen program participants, homebound, homeless population, prison, were they given an option to choose?
Yeah, well, nobody's forced to get these vaccines first and foremost, and so when these programs are being rolled out, it's what's brought there. And in some cases, there were multiple vaccines that were made available. In some cases, they weren't. And so it doesn't. But those who say they want a vaccine but absolutely don't want the Johnson & Johnson, those programs, those are unique cases, and it may just be that they'll have to wait. And so until the other options can be available. But overall, even considering these other subset of populations, that we were opening it up to the entire community, 18 and over, and that being available in all the other pods and clinics as well. We're starting to allow clinics who wanted to have the J&J to request for it, and we're ready to give them supplies this week.
I know that we administered 249 Johnson & Johnson vaccines. Who were those people, and then are we going to be reaching out to contact them?
So first and foremost, again, like, as you mentioned, there's a variety of groups overall, and we wouldn't do anything necessarily different than what we're already doing with the vaccine reaction surveillance, basically. And so there's nothing that changes with that, and that we don't say, hey, any of you guys have a clot in your brain, so it's not like, necessarily something like that, and that we still take the standard precautions and the standard reporting process as well. And so we have to keep that in mind. Now, just so for everyone's information, what are the symptoms of somebody with a cerebral sinus venous thrombosis, or a clot in the vein in your brain? Is that the most common symptom is headache. And I want to be very clear about headache, because headache already is a common symptom that you may get after getting the vaccine. I myself had a pretty bad headache. I didn't have a clot in my brain, and it's something that's usually non-consequential, and you get over it. Now, the headaches that people have with this blood clot, it's different. It may be insidious, but then a lot of times it can come with vision changes, with pressure pain behind your eyes, for example, in your head, and sometimes it may come as what we call thunderclap headache, where it's like all of a sudden, boom, you feel like the worst headache in your life. And if that happens, you have to seek medical care immediately. We always recommend that, especially somebody who doesn't typically have headaches. And so, is this going to lead into an uptick of people seeking care? It naturally will. But I think for good reason. But just if you have like a small headache and if you take the Tylenol and you drink some extra water, and it gets better, then you're probably okay.
What about people with pre-existing conditions? I'm guessing like a normal person, healthy, blood clot. I don't know, maybe not that big deal. But what about in people who have hypertension or any other like cardiac or any pre-existing conditions?
Well, aside from pre-existing conditions, what we do know about these type of clots is that they typically occur most commonly, not all, but most commonly in women who are of childbearing years. And so in this case here, where we had the 6 women between the ages of 18 and under 50, they fit that description. So already they were naturally already more at risk than the general population. Women or people in general who have a history of blood clots or who have a family history of blood clots are already at a slightly increased risk for them. Some women who are on oral contraceptives could also be potentially at slightly higher risk. So those are just the known risk factors associated overall. And it just means that, again, if you have any of these risk factors, that you should just be a little bit more in tune, especially if you've already gotten the Johnson & Johnson vaccine. But again, extremely rare. It's way more likely that you could have a complication of COVID or give somebody else close to you a major complication of COVID if you didn't have the vaccine. So I want to make that very clear.
Doc, so who did we give the 249 J&J vaccines to?
I don't have that right in front of me right now, but it did include a variety of groups. And sorry, I don't have that right in front of me.
Okay.
But it was quite a mixed group.
It was a what? I'm sorry. A mixed group.
It was a mixed group. Yes.
I see. Okay.
Okay.
Can we just get any update on whether or not the new shipment arrived? It was placed on Friday, and they said within 3 to 5 days it would be the new shipment of all the vaccines.
I don't have a specific update right in front of me right now, but it may be tomorrow, Thursday, that we could be expecting it. So,
anything new with the variant, the samples that were sent? I think for February.
No. Yeah, as of my understanding yesterday afternoon, that there were still no new results for the sample sent to the CDC.
Okay. And everything's still on track, right, for Path to Half, despite this setback?
No, I asked that.
Everything's still good to go?
No, he said that it could not happen.
What?
Well, it could. We're going to get very close, and there is still a possibility that we could get there. Just depends on what the turnout is with the other vaccines as well, and how many people actually come out for their second doses in the expected time period. But again, not the end of the world if it happens on May 2nd instead of May 1st or April 30th. It's not, again, not the end of the world. Safety first, right?
Have we kind of plateaued, or people are?
Oh no,
okay,
no, not plateaued at all. It's revving up and really revving.
Okay.
Oh yeah.
All right. Anything else going on with the public health that you guys are kind of eyeing or monitoring?
No, nothing else in particular.
Okay.
Where we are in terms of every project that has been laid out, we're pretty much on track. Here, there hasn't been any major setbacks overall, in our efforts, and so we think, and in terms of what may change with quarantine, nothing's changed with quarantine. And so we're still pretty firm on how we want to move things forward, especially over the next couple of weeks.
All right, Doc. Thank you so much.
Thank you, Doc.
Okay, thanks.
All right.
Have a good day, everyone.
We'll see you again.
Stay safe.
There you go. Dr. Felix Cabrera, Department of Public Health and Social Services Chief Medical Officer. Like you said, will this pause in the Johnson & Johnson vaccine affect the Path to Half? More than likely, yeah, but it's not going to be the end of the world. Thank God, because I couldn't handle an end of the world